This is Courtney McDougall, and I'm going to talk to you about asthma. Asthma is a disease of the lungs that is oftentimes chronic, meaning that it is always present, though at times it may lay dormant. Asthma symptoms can be treated by medications, but there is no cure. Asthma causes the airways or bronchial tubes of the lungs to be inflamed and swollen, which makes it difficult for air to flow. They can become so inflamed that they begin to close off. The symptoms of an asthma attack are often triggered, which causes a limited ability to be able to breathe freely. There are a number of different types of asthma categories that also have different triggers. So what is asthma anyways? There are 3 specific types: exercise-induced asthma, occupational asthma, and allergy-induced asthma. These definitions of each type are cited from mayoclinic.org. Exercise-induced asthma is triggered by physical activity, which can be worsened by cold and dry air. Occupational asthma is triggered by chemicals, fumes, gases, or dust within the workplace. Allergy-induced asthma is triggered by airborne elements like pollen, mold, skin particles, dander, and many other things. Asthma is a disease of the respiratory system, specifically the lungs and airways. It affects your ability to perform tasks freely and comfortably. Typically, you have an inability to inhale or exhale. When asthma is triggered, the airways become blocked by a mucus substance, which then causes the air to stop flowing. The signs and symptoms of asthma are wheezing and whistling sound when you exhale, and it is often seen more often within children. Chest tightness when normally breathing is another example, and the inability to catch one's breath or the shortness of breath. Coughing or wheezing that is increasingly worse when induced by a respiratory infection, and finally, trouble sleeping by any or all of these symptoms. In order to be diagnosed for asthma, you must have had chronic symptoms that are deteriorating the ability to have a functionally normal day. A visit to the doctor's office to have a variety of testing done will allow a physician that specializes in allergy and immune system to conclude treatment based on the results of the examinations and the severity of your symptoms. Some of the testing may include a spirometry, which will determine the tightening of the airways, and a peak flow meter, which will measure the ability to exhale. As stated earlier, symptoms can only be treated as asthma does not currently have a cure. There are 4 classifications of asthma, and treatment will depend on which category your symptoms fall into. Mild asthma is typically treated with an inhaler. Moderate is often treated with inhalers and medications, and severe asthma is treated by medications, inhalers, and nebulizers. Corticosteroids are often used as treatment for asthma, as it allows the airway to be opened and the bronchial to be soothed and relaxed. There are many other types of treatments on the market today. Some inhalers range from wet to dry aerosols, pills, single-use inhalers, and long-term use inhalers. And in conclusion, you always have to know what triggers your asthma to flare up, especially if it is allergy-related or work-related. You can carry your inhaler around to be prepared if an attack is likely to happen. The CDC states that those with asthma are at higher risk for influenza-like viruses due to their already compromised respiratory system. Be prepared, be mindful, and get your vaccinations.